Patient asked me this today and said, what should you do about an overactive vagus nerve? So the short answer is that an overactive vagus nerve is probably not the problem. You probably have a problem called vasalvagal syncope, which is what most people might associate with an overactive vagus problem. You might not know the term vasovagal syncope, but it's a problem where people faint, and it's not a fainting as a result of cardiovascular problems. Vasovagal also includes presyncope, which is all those crappy feelings that people have right before they faint, like feeling suddenly warm and sweaty, blurred tunnel vision, nausea, cold, clammy skin, etc. The reason it's probably not an overactive vagus nerve is because a lot of people have these symptoms when they have a really stressful stimulus that is present. This is probably most frequently seen when people have blood aversion. So if someone sees someone bleeding, or if they're giving blood or giving a blood draw and they have some of these symptoms that pop up that may lead to fainting. We don't really know what happens, but they think that when people have these stress hormones inside of their system, their nervous system dysregulates and the ability to control their blood vessels gets affected, leading your heart to start to go into bradycardia, which means you're not getting enough blood flow into the brain, your brain becomes hypoxic, and then people can start to faint. So the main problem isn't actually the vagus nerve. A lot of people think that there is actually a sympathetic withdrawal that occurs, which means that the vagus nerve is on by default, and then fainting precedes that. So when you have this condition, you don't necessarily have to avoid doing stuff for your vagus nerve. You just have to do a better job of being able to regulate your vagus nerve. And here's one trial that gives an example. It's called the Effective Yoga on Clinical Outcomes and Quality of Life in Patients with Chronic Vasovagal Syncope. So the study took patients with chronic vasovagal issues, meaning that they had recurrent vasovagal problems, and they randomized them into traditional medical care or traditional medical care plus a yoga intervention. At the end of 12 months, the control group had an average of about 2.5 vasovagal episodes per patient, while the intervention group, their patients had an average of about 0.7 vasovagal episodes per year. So we don't have a placebo yoga intervention, so we don't know if this effect is unique to something special about yoga itself, but here are some of my thoughts. When I'm working with patients with autonomic dysfunction like vasovagal syncope, one of the most important things I want them to establish is the ability to feel like they can control their physiology in the face of a stressful situation. My personal preference is something like breath work, and it's not breath work to train their vagus nerve, it's actually to just give them a sense of control over their physiology. With breath work, you could get someone to breathe fast and hard to ramp up their nervous system. And then we know that slow-paced breathing, especially that resonance frequency breathing, makes people feel like they could calm their nervous system down in a moment of stress. I want them to do both, not because I just want them to stimulate their vagus nerve, but I want them to have a sense that they can control their internal physiology in the response to stress. Because it's that sense of control in the face of stress that gives people a sense of resilience, which is part of our philosophy of making our patients anti-fragile.